Hi guys, good afternoon. This is Dr. Jenny Yusuf, physical therapist and Dr. Physical Therapy, creator and founder of Balance and Fall Support Group in Aging Adults and founder of Physiogen PT and Wellness. So I am a certified exercise expert in aging adults and vice chair of Global Health in Aging Adult. So it's my opportunity for you guys to do the podcast. Thank God it's Thursday. And for our balance and falls, every Monday we do a highlights. So for tonight, we would love to share and know more about our guests. So every Thursday, we featured what we call as Thank God it's Thursday physical therapist. Physical therapy entrepreneur, and also academicians, innovators. So for tonight, we would love to know more about Dr. Heidi Moyer. All right. Dr. Heidi Moyer is one of our panelists and speaker for our recent Geriatric Rehab Summit 2023. So she had a wonderful topic about balance and pulse, especially in neuro. And she is a physical therapist like us, a doctor of physical therapy, certified exercise expert in aging adults, and a board certified specialist in geriatric physical therapies. So she is also current full-time assistant clinical professor in the Angelo State University, doctor of physical therapy program, and has previous experience teaching continuing education for the evidence in motion. So we have many colleagues, especially for the Academy of Physical Therapy Association and also the American Filipino PT Association, Dr. Heidi. We have many physical therapists who undergone and went to your courses in evidence in motions. So without further ado, I would like to give the floor to introduce herself to us also. And thank you so much. Welcome, Dr. Heidi Moyer.
Thank you, Dr. Jenny. Man, I don't know if I can give a better introduction than that to myself. I always feel like other people do it so much better. As you know, my name is Dr. Heidi Moyer. I'm a doctor of physical therapy. I am currently in full-time academia, but I do continue to practice usually between 8 and 16 hours a week as a PRN physical therapist in the acute care setting. Just kind of depends on how busy each week is. But I do have previous clinical experience in inpatient rehab, which is where I started as a clinician full time. Then I shifted into home health. After kind of during the pandemic, I needed a switch. So I went to long term acute care because I was like, what could be harder than home health? Going to long term acute care and working on the ventilator ward. And then after that, I transitioned to more outpatient before becoming a full time in academia. I have a couple research interests as well. So obviously balance and falls is a big component of my research and my passion and working with older adults. But I also have interest in teaching methodologies, and I'm working on a couple of studies right now looking at the effects of improv comedy on student preparedness and confidence in the clinic, as well as looking at how a general survey that actually just released today, looking at how prepared people feel that their physical therapy education made them in working with older adults. So kind of surveying that.
Oh, the improv, you say something about improv? Oh,
Improv comedy, yeah.
oh yeah.
There's
That's
like a pilot study that was done in Northwestern by the faculty there, and they presented at CSM a couple years ago,
mhm,
and we're repeating some of that here at Angelo State to
mhm.
try to get students out of their shells and just feel really comfortable being uncomfortable, because a lot of times,
Yeah.
especially in acute care, everything is made up and the points don't seem to matter.
Yeah, that's really interesting because my daughter, we just attended in North Carolina, and then that's her category for her competition, the improv.
Oh,
And
very nice.
I as a Filipino, we don't use improv. We call it like, what is your skills or category? It's like impromptu. So
hmm
here is like improv because of the, as what you said, theater, comedy. And then she explained to me, oh, they will have a scenario, they will act in some way. So that's her category in her competition
Yeah.
in the mist. So that's really cool. Yeah, that's really interesting, right? So you're doing it in Angelo State University?
Yes, yes, I am. It's very interesting because, when you think about students becoming prepared for the clinic, you can go in with the best set plan. And as many of us know who have worked in the clinic, probably only about 10% of your plan is going to get executed, and you have to constantly adapt. And that can be really hard for a novice learner or a novice clinician. So, trying to get people used to thinking on the fly, thinking on their feet, answering the questions that are presented rapid fire to them is really important. So, we're trying to do that in a low stress environment of an improv comedy class where there really is no wrong answer. Nobody's going to get hurt. Nobody's going to be injured to allow them to develop some of those skills.
That's really nice. Yeah. So what's your favorite setting, knowing that you've been in acute care, orthopedic, now even the long-term acute care you did, home health, I did also home health. Of all
Yeah.
those settings, so what's your favorite and also your advice to some of our clinicians very new in America?
Wow. Yeah. I think every setting has their merits, and I liked and didn't like different things about each of them. I know in inpatient, I really appreciated seeing large scale changes in a short amount of time, and that was so exciting. If I had to pick a favorite setting, though, I would probably say home health. I
Mhm.
really enjoyed getting into people's homes, being at ground zero, helping them to manage their health conditions. You also have to have a very high health literacy in home health as well. So you're not just doing exercises and working on functional mobility, you're helping to manage medications and following up with doctor's appointments. And I really enjoyed that aspect of it because I felt it was so challenging that I learned a lot through, the different scopes of practice. And I felt like my interprofessional collaboration care really improved by
Mhm.
being challenged in that way and having to take on more than we typically would as physical therapy professionals in other settings.
Mhm.
As far as kind of advice of people who are starting to enter the clinic, whether they were foreign trained and then coming into the healthcare setting in America, or just new grads graduating, and entering the workforce, my biggest advice is be open minded and be ready to learn. Even 7 years out as an expert, as somebody who teaches continuing ed, I'm constantly learning new things or relearning things I perhaps forgot in my entry level education. So, having an open mind, being prepared to learn, not being afraid to ask questions, either of the patient to get to know them better or of other healthcare professionals is really important. And then my last piece of advice is don't be afraid to advocate for your patients. You are
Yeah.
never wrong if you are advocating for what's best for your patient. You might be the only voice expressing that opinion, which can be really tough as anybody who's new to a team, even if you are more experienced. But doing the right thing is never the wrong thing.
Nice. Yes, that's true. In my home health setting, I really enjoyed a lot seeing them in their own, like, of course, they're very comfortable in their
Hmm.
place, but you're like a physical therapy. Sometimes they forgot we are PT. Because
Yes.
we're doing a nursing thing with our medication, and
Yeah.
then and we're talking to their doctors for follow-up, and then sometimes I have one patient that he's not in the mood to do anything, and then I said, why you're not in the mood? Because he has, so you're talking like a psychologist. And then he said, oh, I
Yes.
thought you are already my psychologist, I'm about to see her next week. you know we wear different hat in that kind of setting, which I totally agree. Yes.
Yeah. I
So
feel like
that's
that's
really
really
great.
where we get to kind of spread our wings, because in our education as physical therapists, making medical diagnoses and providing cognitive behavioral therapy is not within our scope officially, but we are performing a lot of that in order to get our job done. So it's
Mhm.
a really unique environment to be able to flex all of your strengths and skills on, really, because sometimes in some instances, a very fast moving patient where we're very medically complex and we need to make decisions now, or this person's going to end up in the hospital again.
Yes. So what will be your favorite resources, Dr. Heidi, if they will ask you of all the different kinds of certifications and also preparations in our setups right now, what helps you a lot? What courses or books do you want to recommend for our clinicians that
Hmm.
are gearing towards, of course, geriatrics and whatever your recommendation as well? That
Yeah.
that really builds you to be a good and great clinician as you are right now.
Yeah. I feel like it's really hard to recommend one source because they're like, especially when you work with older adults, you have to know about every body system, and then you add the aging process on top, and then you add a pathology. So it's hard to really like recommend one source or resource. I know that a couple of books that I constantly go back to are Guccione's Geriatric Physical Therapy and then Geriatric Rehabilitation by Tim Kaufman. Those are two textbooks that I like probably reference every day
Oh, nice.
because they're so comprehensive. So those are two, and I have no, disclaimer, no financial agreement with any of these people, and there's no issue here, but those two books are just absolutely so helpful, and are very comprehensive and are written by experts, and are great resources.
Mhm,
Other resources that are really useful, I feel like it's so helpful to be a member of your professional organization. Because it really, and I do this for a living for continue, aside from teaching entry level doctor physical therapy and in the clinic, I teach continuing education. And really, we're knowledge brokers, right? When we're creating classes like this, we're spending hundreds of thousands of hours to comb through everything to create a packaged product. And I was having a conversation with a colleague the other day about this. Like, I get why people pay for continuing ed, because as a clinician, if I had to sit down and spend hundreds of hours to research one topic to arrive at 2 points, like it's just not efficient. So, making, and I think that our professional organizations do a great job, whether it's APTA or American Filipino Therapy Association or Filipino Physical Therapy Association, whatever. I think they do a great job of making sure that we're looking through the research and then providing products, or knowledge translation tools. So, really what our professional organizations, be it at the federal, national, or state level, they produce a lot of helpful resources
mhm,
outside of like the strict like PT knowledge. One book that I recommend that I was really eye-opening to me, because I'm a type A perfectionist personality and would literally run myself into the ground for people. I can't remember the author, but the title of the book is Patients Come Second, and it's written by a hospital CEO that talks about how, when he took over kind of this healthcare system, he stopped focusing on the patients and started focusing on the healthcare workers. And his motto is, if you take care of your healthcare workers, they take care of the patients, and you don't have to worry about the patients, they worry about them. But if you're working on staff turnover, mental health support, making sure people are getting the breaks and the rest and the benefits that they're owed, you actually see healthcare improve for the patient. So the book Patients Come Second, I thought it was really eye-opening for me, to read through and have be like, okay, you know what? Yeah, I should sleep, more than 4 to 5 hours a night. And sitting down to eat dinner is a good thing for me, because then I am filling my cup to help other people. So kind of on the other side of just, healthcare perspective, that was a really useful resource.
Oh, wow. That's really makes sense because how can we really work properly if we don't have a 100%, sleep,
Hmm.
and also that we eat well and we have those energy. And I feel bad because honestly, that's really true. It's really important. I met some grumpy nurses, aides, CNAs,
Yeah.
and then I said, because the company really doesn't made them
Yeah.
really secured or well,
Right.
maybe paid off, or they call the night staff to continue the
Right,
work.
or they're on
It's
their 5th
unsafe.
double shift for the week and they're
Yes.
exhausted, right? And that comes through for sure. And I feel like that's, we put on our war boots and we went to war during the pandemic, and I feel like a lot of us got amnesia after COVID because the public health crisis is over.
Mhm.
And, we all kind of went back to our business, and I feel like we've all kind of forgotten how angry and overrun we were. And I think we're still trying to, I think it's important for us to remember what it was
Mhm.
like as a healthcare provider in that time,
That's
to
true.
be able to appreciate balance now. And I know I appreciate it a lot more,
Yeah.
because a lot of us were, for those of us that were lucky enough to keep our jobs, there were some unlucky that weren't. The lucky ones then now had to deal with all of this stress and working additional hours and everything. And especially when we're working with older adults,
Mhm.
it's in every setting has their challenges for sure, but we're working in settings like SNF, inpatient rehab, acute care, settings that can be really high stress, especially depending on what kinds of patients you're working with. And you really need to be well rested, well fed, and well hydrated to be on your A game for these people. Because, we could catch something like a UTI or a DPT, and if we're tired,
Yes,
we might miss
that's
those
true.
things.
Yeah, even me as a home health physical therapist at one point, I hold my pee and then I will have
Yes.
UTI. I keep saying drink good, well
Hmm.
hydrate, and I'm not the one really hydrating well because I keep driving with less
Yeah.
water. I'm guilty with that. Every time I remember, I have an interview and she also highlights how we need to take care of ourselves. And then I
Mhm.
said, oh, I'm guilty with that, Dr. Dale. And then she told me about those things and
Yeah.
everything. And then we really need to take care of ourselves. And congratulations as well, Dr. Heidi, because you're a doctor of physical therapist and also you are doing your teaching, especially with the CEUs and in evidence in motion. I have many colleagues talking about your program and everything. And they said, oh, Dr. Heidi Moyer, she's one of my professor and teacher. And then I know evidence in motion from them. And I interviewed also the CEO. But tell us more how important we need to continue learning, especially we talking about this. We need to build ourselves, keep learning, and also those CEUs you're talking about, research.
Mhm.
Why it's important for us as a clinician to keep improving ourselves and invest in our knowledge. Mhm.
Because things change so fast. Just even year to year, we have new research articles that come out to support different ideas or refute an idea that we used to hold as like a gold standard. Now we know that we need to shift. And, when you take breaks and you're not investing in your knowledge and your education, then that's going to hinder your patient's improvement, right? Now, it's not to say you have to change everything about your clinical practice every year because that's exhausting. But you need to continue, if you continue to stay up to date, then you can build yourself up to a clinical practice where, oh, I learned one new thing and I'll just shift this over here and make a few adjustments. And now I'm able to continue my excellent quality of care. I feel like where a lot of people get really stressed out and really have a hard time with it is where they don't take education for a long time. And it's really hard to build yourself up. So staying up to date is easier to make, a course correction change here or there versus completely overhauling your clinical practice because you haven't really taken a competitive continuing education course in the last 10 years. So that's really important. The other thing too is with continuing education is making sure that you're taking it with somebody you trust. As far as their opinions and their knowledge, there is a lot of information out there, and especially in the advent of social media, anyone can put anything out there. And I have to really watch myself and, hashtag not start a fight on the internet sometimes because I'll watch some of these videos and I'm very interested and I'll start to talk to the creator and be like, what's your source? And they're like, oh, I don't have any information for that. I'm like, well, then how can you make this claim? Like research it, support it, at least pull, a theory somewhere to support it. So it's really important to make sure you're not only taking courses, but that you're taking them from quality companies who are vetting these sources and are using the up-to-date information to make sure that you are getting the appropriate translation of that research to practice. Because it can be sometimes complex, especially with like hotter topics. It's, you want to make sure you're working and discussing and talking with people that are kind of on the ground trying to figure this out along with you, and making sure that they're looking on all sides of it.
Yes, yes, because I have many colleagues, they are looking forward to continue more on their certification, specializations, and then knowing that I am geriatric, so they're asking more resources. And
Mhm.
then, so I would love to learn more about the evidence in motion, your certification program. I believe you have a doctorate and then plus certification on geriatrics, and you have a plain geriatric specialization classes as well. Can you tell us more so that they will be able to listen with you when they watch this video, please?
Sure. Yeah. So Evidence in Motion has a lot of different programs. So I'm the geriatric curriculum program director. typically what will happen, and we get a lot of Jerry learners through this, but we also have a transitional doctor physical therapy program, which is what a lot of clinicians will take. And as you take that program, you have the option to kind of subspecialize either in orthopedics or in geriatrics. And I get a lot of people who are doing both the transitional doctorate and the geriatrics curriculum. With that, within the geriatrics curriculum, we have 2 tracks right now. The majority of our courses are, rolling enrollments. You can take them anytime. But we do have a couple of tracks for people to get a little bit more focused learning. So we have a foundational track and an advanced track. Our foundational track is really designed for clinicians who see older adults occasionally enough to know that they need to know more, and they might not feel so comfortable managing them, but it might not be their primary population. Maybe they work specifically more with younger neuro patients. Maybe they are working in an outpatient orthopedic clinic. So it's not their primary demographic, but they are working with them. That is over the course of 6 months, and there's 3 online classes and 2 in-person weekend intensives. So the online classes are introduction to geriatric rehabilitation, exercise prescription and planning and for physical activity, and then health promotion and wellness. And those are the 3 online classes. And then we have 2 in-person weekend intensives that are kind of hosted throughout the country. One is balance and falls management. That is the one that I teach. And then we also have management of orthopedic conditions, which is really valuable because you get to kind of brush up on your manual therapy skills. For those of us that sometimes get stuck in, Medicare Part A world in some of these settings, it's nice to go back and refresh our special tests and all of that. Then in our advanced content, we have all of those classes as well as cardiopulm, neuro, and then we have a hospice class as well, because just as it's important to make sure that from a health promotion and wellness standpoint, people are getting moving, it's also important for us to participate in the process of referral to hospice and end of life planning, because we do see that when we're working not just with older people, but in healthcare in general. In the advanced class, we have the 2 weekend intensives that I mentioned in foundational, and then everything else is online learning. The online learning within the online classes, there are 3 faculty-led courses led by myself and 2 other individuals for neuro, balance and falls, and ortho, in which you will work on case studies, discussion boards, and get a chance to interact with us as well as your other learners. So those are kind of the 2 different tracks we have. The advanced takes 12 months. What we have set up is if you decide to take the foundational and then want to do the advanced, we prorate your tuition for that. So you don't have to retake those courses. And then you can actually spread your learning out over the course of about 18 months or so, to kind of help spread out that information. I'm really, really excited about all of our programs. So I recently came into program director about 2 years ago, and we have massively updated absolutely everything. We are now interdisciplinary as well. So it's not just for PTs, it's also for OTs and CODAs. And what I really love is that we don't just have PTs teaching, but we also have 2 occupational therapy professionals as well as a pharmacist that's helping to instruct. So it's interdisciplinary. So you get a chance to hear from other fields. And also within our PT faculty, we have people that are board certified geriatric specialists, fellows of orthopedic and manual physical therapy, certified wound care specialists, neurologic specialists. So you really get the gambit of people in all different settings. Some are full-time clinicians, some are in academia, some are in research, and you really get to hear a lot of different voices, which I think is important. You of course want trusted sources, but I think that hearing similar opinions across different fields and specialty levels is really important to look at elevating that quality of care.
That's amazing. Is the class going on in this semester, or is it trimester, quadri? How
Yeah,
does
so if you take any of the courses individually, it's rolling admission. So you can just
okay.
sign up and get loaded into the course. If you want to take the specific foundational or advanced track, we will actually be accepting our next cohort for January of 2024. So that application is open, and I can send you the link if you'd like for people to apply if they're interested. And I'm more than happy to give my email as well, for you to attach to the video if people have questions about that. But we'll have our next cohort starting in January, which will be
Oh,
great.
less of time, yeah. So
Yeah,
that's
yeah.
really interesting. I like those different you involve pharmacists, interdisciplinary team, knowing that PT and OT combined, home base, home modifications, things like
Mhm.
that. And also we have foundational and then advanced. So I like those in-person classes too, because we really need a laboratory or manual part of it. So
Yeah.
thank you so much, Dr. Heidi. We learned a lot from you. And then one last question: what's your best and favorite physical therapy balance exercise for our, so give a tip for our balance and falls listeners here.
Perturbation training.
Ah,
I love pushing people around the clinic and in the hospital rooms and in their homes. Perturbation training is on the rise. The new Falls clinical practice guideline, which is not out yet, but we got a peek into it at CSM this last year. Perturbation and multimodal training are going to be huge in that. So really working at high intensity exercises and working on recovering from slips, trips, and falls is absolutely essential to helping to manage bounce and falls conditions.
that's really good. Even Dr. JJ Maudertini, she kept emphasizing that in her lots of her research and topics. And then she
Mm-hmm.
showed that on the last geriatric rehab summit, like those there's a belt also, and then also slip and fall, like
Yes.
perturbation training on the treadmill.
Mm-hmm.
And I think we will also highlight, there is one treadmill is more on perturbation, and
Mm-hmm.
that is another for the balance as well. So we'll
Yeah,
talk
it's the one
about
that
that.
like rapidly accelerates and decelerates
Yes,
quickly. Because normally you
yes.
just put stop and it slows down slowly, but there's one that actually reverses quickly, which is awesome.
Exactly. Yeah, and that's from the Meditouch Balance Tutor, like they do
Mhm.
something like that. And we'll talk more about those. It's really different. Imagine our treadmill supposed to be facing forward, and this one they are reversing on the
Yeah,
opposite side. And I'm always afraid doing the opposite on anything that rides and everything. I easily
yeah.
feel dizzy.
That's where I love those overhead harnesses for patients. It's like I feel a lot better knowing that nothing
That's
can
right.
happen to you.
That's right. Thank you so much. So that's what we need to add on perturbation training.
Yes.
So that's really a balanced technique there. So thank you, Dr. Heidi. So can you tell us your how we can connect with you, like your emails or website?
Yes.
Yeah.
So you can email me at hmoyer@eimpt.com. I'm also on Instagram. I usually post more videos about dogs and about professional stuff, but you can find me on Instagram at non.binary_DPT. And then you can also find me on the evidence and motion handles as well for EIM team.
Thank you so much. I always see your dog. They are black. What breed are they?
Mixed. We have no idea. They're rescue puppies.
They're two, right? Are they
We
two?
have we have two. We call them the knuckleheads. Yeah, Buck and Stone.
They're
We're
big.
embracing Texas culture. They've grown. We got them initially. They were 30 pounds, and they are now almost 60. So they are growing very fast, and it's only been 4 months.
Mix what? Mix when you say mix.
They think lab
Lab?
mix.
Lab? Yeah, that's why
Yeah,
they're
black
huge,
lab.
right?
That's what they kind of look like. That's what we're going with. So
Mm-hmm. Thank you. Thank you so much. I grew up with dogs, so I know I love dogs, but I have cats recently because of my daughter, and it's
yeah.
easy to take care of them. So let's do with that. Thank you so much, Dr. Heidi. We appreciate all your contributions to Academy of Physical Therapy Association. I have many false evidence-based. Sometimes when I do seminars or some
Mhm.
webinars, education in different cases or class, I always see your names and Dr. Mindy on all those research. So
Oh,
we thank you for all those. Because of those research and your contribution, we're able to do some different classes for free for falls preventions, and thank you. We appreciate you. All right, guys, if you have any questions for Dr. Heidi, I will put her information in this video. And thank you so much for listening. All right. Thank you, Dr. Heidi, and God bless.
thank you, Dr. Jenny. Have a good day.
Welcome. You too.